It was today we are going to see the cardiac output and factors affecting it, and they ask the measurement of cardiac output with this. So first of all, we will see the cardiac output. It's amount of blood pumped out of each ventricle per minute. ईच वेंट्रिकल से पर मिनट में कितना ब्लड पंप आउट होता है. सो इट्स कार्डियक आउटपुट. इट्स नॉर्मल वैल्यू इज 5 लीटर्स इन एडल्ट, नॉर्मल एडल्ट, और 5000 ml. Cardiac output is equal to stroke volume times the heart rate. Now, stroke volume. What is stroke volume? Stroke volume is amount of blood pumped out of each ventricle per beat. Its normal value is 70 ml. And heart rate. Heart rate is defined as the number of beats per minute. Simple. Its normal is 75 per minute. Now we will see the factors affecting cardiac output. So first is the venous return. It's the amount of blood they return in the right atrium from different parts of the body. Cardiac output directly depends on venous return. So more is the venous return, more is the cardiac output. Then comes the force of contraction. Cardiac output varies proportionally to the force of contraction of the ventricles. It depends on the preload. Preload is what is amount of stretching of the cardiac fibers due to distension of with blood. And afterload it is pressure in the aorta and the pulmonary artery. And third one is the heart rate. Cardiac output is a direct function of the heart rate. Hence it increases with increase in heart rate. So more is the heart rate, more is the cardiac output. Or we can say it with positive chronotropy effect. Fourth point is the peripheral resistance. So cardiac output is inversely proportional to peripheral arterial resistance. So more is the peripheral resistance, less is the cardiac output. Now comes the physiological variations that occur in cardiac output. These are due to age, sex, body build, environmental temperature, emotional conditions, exercise, high altitude, pregnancy, sleep. So these alter the cardiac output. Then comes the measurement of cardiac output. It's measured by two different methods. First is a direct method and second indirect method. In direct method we use involve the use of cardiometer and flow meter. So these are the instruments. And indirect method, it includes first the fixed principle, most important fixed principle. Second is the ink dilution method. Third, thermodilution technique. Fourth, ultrasound Doppler transducer technique. And 5 is electrocardiography. Then comes the measurement of cardiac output by using Fick's method. So what is Fick's principle? So Fick's principle states that the amount of substance taken up from blood is equal to the arteriovenous difference of a substance times the blood flow. So amount of substance is equal to difference between arteriovenous into blood flow. So remember this. So we use Fick's principle and we modify it and we measure the cardiac output. So if we take Qx is equal to amount of substance taken up or given out, and Ax the ATL concentration in ml per 100 ml of blood, and Vx venous concentration in ml per 100 ml of blood. So CO is the amount of substance taken up or given out by organic organ per unit time divided by arteriovenous concentration difference. So this CO is equal to cardiac output. So this amount of substance taken up or given out is equal to cardiac output. That is cardiac output is equal to, so from this we can reduce this. So CO is equal to Qx by Ax minus Vx. So we will see how to calculate a cardiac output on sample cardiac output calculation. In Fick's principle, the blood flow which is equated with cardiac output and the amount of substance taken up is equated with oxygen consumed by lung. So this is a summary I have written here. Blood flow is equal to cardiac output and amount of substance taken up is equated with oxygen consumed by the lung. So we use the formula cardiac output times arteriovenous oxygen difference equal to O2 consumed in ml per minute in by lung. So O2 consumed by lung is equal to 2 ml per minute. We know this. And arterial blood O2 concentration is equal to 200 ml per liter of blood, and venous blood O2 concentration is equal to 160 ml per liter of blood. To find out the cardiac output, we use the formula cardiac output is equal to O2 consumed in ml per minute divided by arteriovenous O2 difference. So cardiac output is equal to 200 ml per minute by 200 minus 160 ml per liter. ml cancels out, so we get cardiac output is equal to 5 liter per minute. Also, we do the calculation of cardiac output by using carbon dioxide. It is measured in similar way as with oxygen consumption. So cardiac output is equal to CO2 produced by lungs per minute. It's 200 ml per minute by CO2 content in venous blood, which is 60 ml per 100 ml of blood, minus CO2 content in arterial blood, which is 56 ml per 100 ml of blood. So cardiac output comes out to be 200 by 60 minus 56, so which is equal to 5000 ml So by converting ml into liter, we get cardiac output is called 5 liter.